I'm here today with Dr. Eliot Siegel. He's very well known for his experience and insights on artificial intelligence.
Thanks, Katie.
So, nice to have you. Appreciate you coming by.
Great to be here.
So what's up with Artificial 2.0? What's next?
Well, it's been so exciting to see applications emerging to do fairly specific tasks, to look for intracranial hemorrhage, to look for pneumonias, rib fractures, lung nodules. And as time goes on, as we try to implement these clinically, what we're realizing is that we need so much more than the research application or the specific narrow application. And what we need is to have a way to be able to integrate it into our PACS system and integrate it into our workflow. The other thing that I want to be able to do at my PACS workstation is to be able to interact with the engine that does AI. Maybe I agree with part of it, maybe I want to adjust the contours. I need that capability to be able to, at my workstation, control the engines associated with multiple different AI systems. The other thing I want the AI systems to do is to cooperate with each other. So I want to take the result of one AI system and then be able to input that into another system, or maybe even have an ensemble of multiple different AI systems that are all doing the same thing. Let's say I've got 5 systems that are looking for lung nodules. Maybe I can get a vote and a consensus as though I got an expert panel of radiologists to look at the same cases and then derive a consensus. So we can create the equivalent of AI crowdsourcing. And so as time goes on, there are so many interesting things that are opportunities to go to the next level. And I'm really excited here at RSNA to see people starting to think about what will that next level be, how do we consume this practically, and how can we take advantage of being able to start thinking about combining these together and combining them with information in the electronic medical record to create a whole new generation of ways to use AI to help out our patients.
Well, that was very interesting.
Thanks.
What is the current limitation, the biggest limitation you see in the current generation of AI that you would like to see overcome in the future?
There's a fundamental thing that I would like to see improve fairly significantly, and that is the paradigm that we have for the most part with most of these AI applications is to solve a single medical imaging study and to be able to analyze that and come up with an answer. But as a radiologist, particularly for oncology applications, my task isn't so much to diagnose, but to say whether or not things are getting better. Is my patient improving? Is the chemotherapy working? Is the question that the oncologists come to me with. And so what I want in the next generation of AI are tools that allow me to be able to look at prior examinations and the current examination, and then allow me to be able to quantify the change and to say whether there's been change or detect new findings. And so this whole idea of having the AI software have an input of not only the current study, but previous and prior studies is really important to actually allowing the systems to do the job that I'm actually tasked to do. So I'm really excited about some of the emerging companies that are starting to look at the prior examinations in addition to the current one to more closely simulate what a radiologist does.
Well, I have no doubt that next year at this time at RSNA, we'll still be talking about AI.
I'm sure you're right. And so thank you so much. It was really great to have the opportunity to talk with you.
Oh, thanks for coming by. Always very informative. Thank you.